I saw my beloved mother go from a vibrant woman that took care of our family business to a 98-pound woman laying in a hospital bed that could not remember how to swallow water.
We thought maybe she was depressed.
She was losing a part of herself that could no longer connect with me.
We decided that we needed to go to Johns Hopkins, and we went to the Phipps Clinic, and there she was diagnosed with Alzheimer's.
No one knew what it was at the time. We joined a small group. We were the only individuals that were African American in the group, and we felt a little bit isolated.
When my mother passed, we asked that in lieu of flowers, that money would be made available to the Alzheimer's Association for education in the African American community.
We recognized that we weren't doing all we could do to better serve the community.
Baltimore City partnered with the Alzheimer's Association and the Jones family almost 11 years ago as an effort to bring awareness to caregivers through our family caregiver program.
We thought that the forum was particularly important because it was a partnership with members of the community, and it's basically a day-long event where we try to help people understand more about the disease, and we give them lots of opportunities to ask questions and to meet one another.
We talk about research, sometimes research among African Americans, access to services, opportunities for caregivers to relate to one another and know that they're not alone in dealing with this disease.
I think what we're trying to do is say, it's okay. It's okay to reach out. It's okay to say, I don't know how to do this.
There are about 25,000 African Americans in the state with Alzheimer's, and they are twice as likely as whites to develop Alzheimer's disease or related disorders. And when they are diagnosed, they're diagnosed later in the course of the disease.
At the time in which I was a caregiver, there weren't any real support systems.
And so we have caregivers who are not only providing 24-hour care for their loved ones, but they're also working.
There's so much caregiver burnout when your loved one has dementia.
You love your parents, but you give up something.
Families feel isolated, they feel angry, they feel shamed.
The distrust with agencies, with doctors, we don't go and seek out services. We don't go to support groups.
We have so many people who are willing now to share their stories, to let people know that they're not alone.
Our families are no longer victims. They are able to overcome the isolation, the shame, the anger.
We have about 400 participants a year, and every year there are probably about 200 new participants. We know that we are reaching new people all the time, and they're getting access to support much earlier in the course of the disease.
It shows that our voice is being heard.
Just knowing Henrietta Lacks' story, having grown up in Baltimore City, and understanding what the family went through, this is major.
It reinforces the fact that as caregivers, we matter.
For us, it means that we're doing something right in the community, that we're reaching out and helping people who need help and people who can't do it on their own. And just knowing that we are there to support them, to lift them up, and to let them know that they can lean on us.